Hello and welcome again to this 1 minute, 1 image anatomy sessions by me, Dr. Ankit Khandelwal. Let us look at the few features of the Plus subscription over here. This is the NEET PG 1 month package. This is the list of grand tests with the dates and the number of grand tests written over here. These are all the special class features. You have a raise hand feature which has come in the special class where you can talk to the faculty directly. Once you check out, you get both options of Plus and Iconic, and you can use this code to get 10% extra discount. Dr. Ankit LIVE. Let us see the image. Now this is what image. This is the again brain. This is looking at a medial surface of the brain. Which surface? Medial surface. How to recognize it quickly? Look at the corpus callosum, the rostrum, the genu, the body, the splenium part. That is the corpus callosum. It is present medially. Which type of fibers? Commissural white fibers. Corpus callosum. Okay. This whole part. Let me just highlight it like this. This is whole diencephalon. Upper part is T for thalamus, lower part is HT for hypothalamus. And the sulcus which runs from the Monroe up till the aqueduct of Sylvius, this is the hypothalamic sulcus which divides the thalamus from hypothalamus. Now you have to imagine this, what you are looking is the medial surface, but which half? This is the right cerebral hemisphere medial surface. Why? Anterior is this, posterior is this. Why? Because you can see the cerebellum. Okay, fair enough. You see the cerebellum. Here we can see the temporal pole also anteriorly. Okay, so that is the anterior posterior. Now, diencephalon is this is the diencephalon on the right side. There will be simultaneously one more diencephalon on the left side. Imagine this hand is the diencephalon on the left side. This hand is the diencephalon on the right side. Now, once you join them, the very thin, faint space between them, that is third ventricle. So this is the whole location of actually the third ventricle, which is sandwiched between the two diencephalons. Got the point? What are these? These are your midbrain over here, having the aqueduct of Sylvius. That is a thick pons over here. That is the MO medulla oblongata, and you can very well see the fourth ventricle. This whole structure you can see, that is cerebellum. We already discussed that once you remove the cerebellum, and if you look from behind, what you look is the roof. Also look at the floor. This is the floor of fourth ventricle. Already seen that image. Okay. So this area is the third ventricle. These all things, they line the anterior wall. These line the posterior wall. They line the floor of the third ventricle. Also you can say as the interpeduncular fossa. Few things worth noting over here are, you can see this vessel which is running over the corpus callosum. That is the anterior cerebral artery. Okay. Now few things which are coming down from here will be the optic chiasma over here. Okay, optic chiasma, and then you have the tuber cinerarium also at this location, will be the location of tuber cinerarium. Infundibulum, pituitary gland. So pituitary gland is located, is hung from here through the hypothalamus. You know the hypothalamo pituitary axis, tuber cinerarium, infundibulum, that is right over here. These are the location of the perforated substance, the vascular capillaries over here. Behind this area is for the pineal gland, and these are your posterior and the habenular commissures. Posterior habenular commissures. As this is the midbrain, this is the location of the superior inferior colliculi. Superior inferior colliculi, corpora quadrigemina. Okay, these are all the vessels, corpus callosum. This is the location of a very famous fornix, nowadays asked frequently, fornix. This space is actually your lateral ventricle. Right lateral ventricle, there was a septum which used to divide it in this whole area, which is known as the septum pellucidum, that has been removed to show you the cavity of the right lateral ventricle. So looking at a cavity of the right lateral ventricle, now see over here, this area is the whole occipital lobe, the calcareous sulcus and dividing into occipital lobe. Okay. You also have the corpus callosum, as we have just seen. Above this you have this gyrus known as cingulate gyrus. So this cingulate gyrus along with the hippocampus over here, they form the limbic lobe. That is the functional limbic lobe over here. So many other things that we can see, but at least again try to understand. This whole is the anterior cerebral, and these are the anterior cerebral vessels branches. So the main artery supplying the medial surface is anterior cerebral artery. This part posterior cerebral artery. This part temporal pole, middle cerebral artery, but the major part is anterior cerebral. That is why the artery of the medial surface is known as the anterior cerebral artery. So you can look at a lot of things over here, but first have a general idea. Then obviously as we go into details of it, a lot of things come up. That's all for this session, guys. Follow us for more images and MCQ. Thank you.